we will end up getting some kind of a public option and be able to rein in the high costs of health care?
Right.
And also, I was wondering what you think of the election and what it really meant. I mean, does it really mean people want less government, or was there a different message?
Okay, let's get to the answers.
Let me try and deal with those two things, because when it comes down to the election, the interpretation of it is important. If you look at what changed between 2008 and 2010, it's independent voters. And that's the group that the president sorely needs to get back. They voted for him heavily in 2008, and they voted for Republicans heavily in 2010. What do independent voters really want? They want to see people working across party lines, so actually the kinds of compromises that maybe Nancy doesn't like. And so the partisans on both sides are not particularly happy here, but the real battleground is with those independent voters. Secondly, independent voters want to see a change. They want to see a change in the way Washington works. And the compromises that really mattered, that Nancy maybe was referring to, are the things like transparency, the kind of backroom deals, signing 9,000 earmarks into law, which the president did in that first giant appropriations bill. Those were things that said to, especially independent voters, maybe this guy wasn't straight with you. And that's where the revivalists come down in terms of the bad compromises they made to Washington's ways. They were unnecessary. They didn't actually give them much. They undermined the brand. When it comes down to the public option, though, it is worth addressing this. I hear this from progressives all over. This president never, as a candidate, talked about the public option. He didn't even agree with the individual mandate as something that he was going to support, and that's actually now law. No serious Democrat suggested that there should be a government plan, not since the Clintons' effort in the early 90s. And the way, as I describe in the book, the way the public option took on a life of its own, the way that whole debate took on a life of its own, was a real barrier to getting health care done. And I recount a scene where Chuck Grassley, who was about the only gettable Republican in the Senate, has a final confrontation with the president, or rather the president confronts him. Inside the Oval Office, they say, listen, Senator Grassley, this is your plan. This is essentially the policy that you've advocated all of these years. If we give you everything you want, can you still support it? And he said, well, no. But he asked for something in return. He says, Mr. President, if you go out publicly and say no public option, then I'm with you. And the president couldn't do it, even though there was never going to be a public option. He couldn't say no public option because he would disappoint people like Nancy. So taking it off the table meant that everyone's political options would have been constricted. So the public option was a distortion. Nobody seriously advocated it, not John Edwards, not Hillary Clinton in the primaries, and I would argue that it actually cost the White House politically. Maybe Chuck Grassley would never have been there, but it certainly distorted the debate.